everyone. Let us discuss about chickenpox. Chickenpox, it is an acute, highly infectious disease caused by the virus varicella zoster, also known as human alpha herpes virus 3. Now this virus, it can cause two types of manifestations depending upon the host. Chickenpox and herpes zoster. Chickenpox, it is also known as varicella, whereas herpes zoster, it is known as shingles. The chances of developing herpes zoster increases with age due to decline in cell-mediated immunity, and thus herpes zoster, it is a more severe form. Whereas talking about chickenpox, it is usually a self-limiting condition or disease, especially when occurring in children. But severe form of chickenpox occurs when it is in adults, infants, immunocompromised, and pregnant. Fine. So in these people, there is severe form of chickenpox may occur. Now talking about the epidemiology, we'll discuss about the agent factors, the host factors, and what kind of environment is necessary for chickenpox virus to survive. Now coming to the agent. Now can you all guess what is the agent causing chickenpox? Yes, excellent. That is the varicella zoster virus, also known as human herpes virus 3. Right? Human herpes virus 3. Now talking about the infection, how it occurs. So first, when we come in contact with the virus, it leads to a primary infection and development of chickenpox. Now this virus, after developing chickenpox, it can go and reside in the cranial nerves or spinal dorsal root ganglia or the sensory ganglia, and thus it may lead to a latent infection which is asymptomatic, and this stage may last for decades. Can you imagine? It can last for decades. The virus is already there. So what protects the virus which is already there as a latent infection? Yes, your immunity. So when the cell-mediated immunity in our body dies or it reduces, it can be either age-related or due to immunosuppression, whether it may be due to immunosuppressive drugs, or maybe it can be either due to some sort of malignancies or AIDS, any other infections. Okay, so all these conditions which are leading to decline in your cell-mediated immunity, that will ultimately lead to reactivation of the virus which were already located along the cranial nerves. And thus, did you ever notice that herpes zoster, this leads to herpes zoster, and these herpes zoster infections or the manifestations, they are always located along some sort of dermatomes or sensory nerve supply. Why? Because the virus, they are lodged surrounding or upon the cranial nerves. That is why they are always located in some sort of pattern or dermatomes. So chickenpox can often lead to herpes zoster in case of immunosuppressed or with increase of age. That is why it is known that chickenpox and herpes zoster, they are different host responses to the same etiological agent. If the patient is a child, or if he or she is having a good immunity, then it will lead to a mild form of chickenpox which is usually self-limiting. But with increasing age and declining immunity, there are more chances of developing herpes zoster, which is a severe form. Now we talked about the agent, how it enters, what sorts of infection it can cause. Then we'll learn how does it enter, what is the source of infection. So of course, it is a case of chickenpox. A patient who is having chickenpox, he or she, they have virus in their oropharyngeal secretions, lesions of skin and mucosa, and thus through these secretions, the virus can be spread via droplet infection or via face-to-face communication. Fine. So that is the source of infection, case of chickenpox. Now, how long is that particular person who is the case infective? So, rash develops in case of chickenpox, which we will be learning subsequently. So, 1 to 2 days before rash and 4 to 5 days after the appearance of rash, the person is infective, and maximum infectivity is seen at the onset of the rash, and the secondary attack rate rate is around 90% because it is a highly contagious disease. That is why the secondary attack rate is very high. What are the host factors responsible? One is your age, so it usually occurs in children, fine. But if it occurs in adults, it is of severe form. Talking about immunity, so we already have IgG antibodies from the maternal side, which are protective immunity or antibodies during the first few months. Also, we have cell-mediated immunity, which will prevent the reactivation of the virus. Then coming to environment. So chickenpox, it is usually a seasonal disease with more conveniently developing in winters and springs because varicella zoster virus, it is a heat labile virus destroyed by heat. That is why they are more prone or more active during winters and springs. And because it is heat labile, the virus, it is killed in few hours in external environment, and thus fomites, that is the inanimate objects, they don't play role in transmission. Only droplet nuclei, person to person contact, these are the routes of transmission, and entry can occur through the upper respiratory tract as well as conjunctiva. There is one more route of transmission which can lead to a severe form of varicella, that is chickenpox. This is the vertical transmission from mother to fetus, that is placental. Okay, so this particular infection, that is known as congenital varicella syndrome, and this usually occurs when the mother gets chickenpox during first 20 weeks of gestation. And this is a severe form which leads to many conditions in the fetus like retinitis, cataract, microcephaly, atrophied limbs, etc. etc. Talking about the incubation period, so it takes around 7 to 21 days for the virus to come in our body, and before the onset of the symptoms, around on average 15 days is the incubation period. And then comes the main part, that is your clinical features of chickenpox. Now the clinical features, it can be divided into two stages. The pre-eruptive stage, which lasts for about 24 hours. Then coming to your eruptive stage, which lasts for 4 to 7 days. Now talking about the pre-eruptive stage, it is characterized by sudden onset fever, backache, shivering and malaise. And in adults, this stage is severe. It can lead or last to up to 2 to 3 days, whereas in children, it is usually short lasting of 1 day. After that comes the most important thing, that is your eruptive stage, which lasts for about 4 to 7 days. Now the first stage of this eruptive stage, or the first sign, is your rash. And rash comes on the day fever starts. With every fresh crop of the rash, it is accompanied by fever. Whereas in smallpox, if you remember, once the fever subsides, after that the rash will come. Okay. When talking about the fever, temperature will increase with each fresh crop of fever. With each fresh, pardon me, here it is each fresh crop of the rash, right? Then coming to the distribution, so the rash is symmetrical, centripetal. Centripetal means first it occurs on the trunk and then it goes to the extremities. Trunk, then to the face, arms, etc. Palms and sole, they are not usually affected. Then coming to the evolution, how does it happen? First the rash is formed, fine. Then coming to macule, papule, vesicle, scab. Now these particular stages, they are so rapidly evolved from one to other that they are not clinically visible. What is usually visible? That is vesicle form. The vesicle, it is formed of clear fluid and it appears as dew drops on the skin, and it is not umbilical. I have made a separate video on the differences between smallpox and chickenpox. Please do look at the video for few more differences. Fine. So the vesicle, it is formed of clear fluid, means pus is not there. If pus is present, then it is known as pustule. So pustules are not seen, usually not seen here. Also, the chickenpox rash, they are superficial and easily ruptured walls. Fine. Then coming to pleomorphism. All stages of rash may be seen simultaneously at one time in same area. For instance, if this is your face, then pustule, macule, vesicles, scab, everything may be present simultaneously, whereas that is not the case in smallpox. Then coming to the complications of chickenpox, it is usually a self-limiting disease and severe complications may occur, although in adults, children it may occur. Okay, and who are at the most risk of these complications are the immunocompromised patients. Now, who are these immunocompromised? One, which are having some sorts of malignancy, especially children with leukemia, with organ transplants, then people having HIV infections and high doses of corticosteroids. So these immunocompromised people, they have some sorts of complications, and I have made a mnemonic for it that is known as Harpic bed. Okay, Harpic bed. Now H stands for hemorrhages, A for ataxia, R is for Ray's syndrome, P is for pneumonia, E for encephalopathy, C for congenital varicella syndrome, which occurs only if the mother is infected during pregnancy. Fine. Then coming to bed, that is bacterial infections, secondary bacterial infections, especially Staph aureus and Streptococcus. Then in eye, various complications are involved in the eye, especially acute retinal necrosis. So varicella zoster is the major cause of acute retinal necrosis. And D is for disseminated intravascular coagulation. Now from all these complications of chickenpox, pneumonia. Pneumonia is the most common complication in adults and in immunocompromised. Fine. So you need to remember varicella pneumonia. It is the most common complication in adults and immunocompromised. Fine. So these were all things about the clinical features of chickenpox. Then we dealt with the complications of chickenpox. Now coming to lab D, this is some sort of microbiology over here. Fine. So the best method is PCR. Apart from this, we have various things like cell culture, detecting serum IgM specific antibody. Fine. And for purpose of screening, either to assess immunity or to assess susceptibility, we find or we do serology test for IgG antibody in the serum. Fine. So that was about the lab diagnosis. Talking about the control, so we discussed that the cases are the infective stage. So what can be the best control apart from isolation of cases? Of course, isolation of cases is the best control. The case should be isolated. The patient should be isolated 6 days after onset of rash. Fine, for around 6 days. Also, for control, we should disinfect all the articles which are soiled by the nose and throat discharge, which may still be having some sort of viruses. Fine. And apart from that, treatment part, if I say, then the most important drug is acyclovir, and other drugs like valacyclovir and famiciclovir as well as foscarnet, they are preferred in adults, but the drug of choice is the acyclovir. Coming to prevention part, so this over here, it is important. Please pay some attention in this thing, okay? So prevention of chickenpox. It is done by two things. One is the immunoglobulin and the other one is the vaccines. Now immunoglobulin, it is given within 72 hours of exposure to high risk individuals. Now high risk individuals, who are they? The susceptible people over here are, one is pregnancy. Pregnant female, they are susceptible to this chickenpox. Newborns, fine. Then premature infants, newborns of mothers who are infected with varicella zoster, fine. Or if after delivery, if the mother, if after 5 days of delivery, if the female, she develops chickenpox, then also the newborn should be given varicella zoster immunoglobulin. Then premature infants of low birth weight, and finally immunocompromised, that is those receiving immunosuppression, congenital cell mediated immunity deficiency and HIV AIDS. So these people, they should receive immunoglobulins. Then no therapeutic value in established disease. This immunoglobulin, of course, once the disease is already there, you can't prevent the disease. This is just for prevention before the disease, fine? And not to be given concomitantly with vaccine. later we will discuss that vaccine, it is formed of live attenuated strains of varicella zoster virus. But these immunoglobulins, they are type of antibody, and vaccines contain virus. So antibody will react with the antigen of the virus, and thus they should not be given together. And this immunoglobulins, they are given by intramuscular injection around 12.15 units per kg of body weight. That is maximum of 625 units of this immunoglobulin can be given. Now, next important thing is your vaccine. So the vaccine is a live attenuated varicella virus vaccine. Live attenuated viruses present in the vaccines. Two types of vaccines are currently available. One is the monovalent varicella vaccine, only varicella, and other one is the tetravalent vaccine, which is given along with the other vaccines of measles, mumps, rubella, and varicella. Fine. So talking about varicella vaccine, it can be given to children of, it is very important, please understand it carefully. Fine. It can be given to children of 12 months to 12 years, either one dose or two dose. One dose of 0.5 ml subcutaneously. Fine. And if two doses are given, then the interval between the two doses, it should be 6 weeks or 3 months. Then talking about adults and adolescents, or equal to or more than 13 years, okay, above 13 years or 13 years, they have to be given two doses only, and the interval between the two doses should be 4 to 6 weeks. Fine. So that was the monovalent varicella vaccine. Talking about the tetravalent vaccine, it can be given to children. It is only for children, not for adults. Fine. So it can be given to children of 12 months to 12 years. And first dose is given either from 12 to 15 months of age. And the second dose, it is given at the age of 4 to 6 years. And these vaccines, they will provide immunity which lasts for approximately 10 years. And what are the adverse drug reactions of these vaccines? That is, of course, the common reactions, that is fever, tenderness and erythema at the site of injection, rashes may appear in some. Fine. It is very rare though. Then this is important, that what are the contraindications of the vaccines? So first is your pregnancy. You cannot give, also immunocompromised people. Why? Because the vaccine itself, it is formed of virus, live attenuated virus. So you can't give it to pregnant females or immunocompromised people. Fine. And third one is the allergy to neomycin. If a person is having allergy to neomycin, you can't give them. And also, the vaccine should not be given along with aspirin or any other salicylates, because they will increase the risk of race syndrome, which is already a complication of chickenpox. Remember the mnemonic Harpic? So in that R was race syndrome. Fine. So it is recommended that after receiving the vaccine for around 6 weeks, you should not receive any salicylates. So that was all about chickenpox. If you have any query or doubt or feedback, do let me know in the comment section. Thank you.